Tasha Nelson describes her 7-year-old son, Jack, as a soccer-playing Cub Scout with a passion for science. He's also a kid with what health insurers call a pre-existing medical condition. He has cystic fibrosis. When he was 3 years old, he was on 18 different medications, taking 38 pills a day. Now, one of the 14 medications that Jack needs to live costs over $13,000 a year. Jack's mom, Tasha Nelson, describes herself as a swing voter who leaned Republican. That was until the Republicans voted to repeal the Affordable Care Act. Tasha and her son Jack's lives changed when President Barack Obama signed the Affordable Care Act. She says, "It wasn't until the full protection of the ACA took effect in January of 2014 that I felt safe. For the first time since Jack was born, insurance companies couldn't discriminate against him by withholding coverage. What my son truly needs are politicians who will commit to protecting access to health care for him and for everyone." Republicans now realize that ripping health insurance and health care away from kids like Jack is cruel and inhuman and, oh, by the way, a political loser. And so they are lying about what they have tried to do and what they want to do. And the worst pathological liar in the history of American politics tweeted this today: "Republicans will protect people with pre-existing conditions far better than the Dems." People with pre-existing conditions and moms with 7-year-old soccer-playing Cub Scouts with pre-existing conditions know better. They know the Republicans have tried to hurt them and believe they will try to hurt them again. And so in this election, they are literally fighting for their lives. And Tasha Nelson is fighting for the life of her son, Jack. And joining us now is Tasha Nelson. Thank you very much for joining us tonight, and I'm very sorry that Jack has to endure what he's had to endure medically, and the chores that have landed on you as a mother, and now also as someone who's trying to save the healthcare and health insurance system that you're living under and that millions of other Americans are living under. Tell us about how you've moved as a voter over time because of this issue.
Well, I've always been what I consider a moderate. I have always voted dependent on issues important to me for whichever candidate was going the direction I felt was important at the time. As we age, as we grow, our issues change. Before I was a mother, I had a different set of concerns than I do now, for example. And then last year, the ACA came under fire. And I realized that we could be essentially going back in time to the time when my son could be excluded from coverage so that insurers could profit.
And when the Republicans talk about any attempt they might make to preserve health insurance for people with pre-existing conditions, they do not make any attempt to control the cost of that health insurance. And so they would say to you, here is your health insurance for your son with pre-existing conditions, and it would not be of a concern to them if that health insurance policy cost $100,000 a year.
Right. In addition, the Republican bill that's on the Senate floor, the Tillis bill, it allows you to get a policy if you have a pre-existing condition. What it does not do is keep the insurer from charging you more for your policy or require them to cover the condition that you have. So you'll be paying a higher premium at a ridiculous rate for an insurance that will not cover your diagnosis.
You know, I'm struck by what I've read about what Jack himself knows about his situation, and I've seen this note that we have that he wrote some of it in his own hand, and you helped by writing some of what he said in your hand. And this note was my health care wish for 2018. This is something he handed to a United States senator when you were visiting one of the Senate office buildings, and his healthcare wish for 2018 is simply, "I don't die." And then you asked him what he means, and he said, "I'm scared I'll get super duper sick and go to the hospital and they will say I might die." Tasha, I can't imagine what it's like to be a 7-year-old or to have a 7-year-old who has those worries.
He was 6 when he wrote that. We delivered that last Christmas to Senator Tim Kaine, who was gracious enough to sit with Jack and read it to Jack and asked him questions about what he meant, which was wonderful. Because I think a lot of adults don't realize that a child this young can understand their own morbidity and mortality. And he does. He understands his disease on a cellular level and has since he was very young. He swallowed his first pills when he was 2. He took 5 at a time. At that time. These kids live in hospitals. Last year, he spent over a month hospitalized over the course of the year. And he saw other kids with CF in the hospital who were far sicker than him, and he correlated that with how sick he could get.
And Tasha, quickly before we go, you're going to be voting in in Virginia this year in Republican Congresswoman Barbara Comstock's district. She's running for re-election. How are you going to vote in that race?
I'm voting for Jennifer Wexton. Jennifer Wexton will support health care and protect people with pre-existing conditions. I am now a health care voter. I am not a Republican or a Democrat. If you vote against health care, I vote against you.
Tasha Nelson, thank you very much for joining us tonight. Really appreciate it.
Thank you.
Coming up, more lying by Republicans about their health care policy.